Welcome to In Vibe Life Conversations with Amy, Parker, and Cheryl Dunn. By tuning in, you are joining a community that will inspire you to increase balance, wellness, and joy in your life. We'll offer expert information and insightful conversations to help us on our journey to live more in vibe. For more information and articles, remember to also check out our website at invibelife.com. That's ENVIBELIFE.com. We're grateful that you're here.
Hi, and welcome to the In Vibe Life Conversations podcast with Amy, Parker, and Cheryl Dunn. We are joined today by our friend, my neighbor, Dr. Denise Brown. Yay!
Hi, guys. How's it going?
So we hope to be starting kind of a new series with Denise, and we're calling it something like Ask Dr. Denise. I feel like we should have some fancy music come in to like.
Oh, I want a theme song. Yeah, like that sounds good.
Okay, what should your theme? That's the first question. What should Denise's theme song be?
We're getting right into it.
Okay.
Staying alive.
Yeah.
So many good ones. I mean, Staying Alive is a sort of an all-time. Yeah. Medical classic.
There you go. I think it's a medical classic.
Mama loves her some disco, so let's stick with that. I mean, boom, we done.
All right.
We are women of action.
That's good. Okay, next question. But anyway, we'll bring Dr. Denise on from time to time as our thoughts for any questions we're having out there. Maybe anything she can help explain, or we're getting some viewer questions or tips for staying healthy, for staying alive might be a great one.
There you go.
I like it.
And so we wanted to start today by introducing you all to Dr. Denise. Dr. Denise is an internist, and we wanted to talk first about what is that? What does it mean to be an internist? Because I think this is a question that actually a lot of people have and are scared to ask. It's like we hear all these, this enterologist and this earnest or that. And we kind of throw the terms around, but I don't know if we really, really know what they mean.
Yep.
So what is an internist? How is that different from your general practice doctor or family doctor?
Makes sense. So there's lots of ologists. And so the quick and dirty way to know if someone's an ologist of any kind is they at least started with internal medicine residency training, and then they probably went on to do a fellowship in something. So gastroenterologist is, stomach and GI tract. Cardiologist is heart.
I already didn't know that.
Pulmonologist is lungs, right?
Very good advice.
So here's how it goes, right? So you go to college, and then you go to medical school or osteopathic medical school, either one. And then you go to a residency, and for lots of different things. There can be all kinds of stuff. So when you're in medical school, it's kind of like the trunk of the tree, and then you sort of start branching off. So you might be really interested in family medicine. That's a separate residency. Emergency medicine, separate residency. Maybe you want to be a surgeon. That's a separate branch of the tree. Or you want to go into internal medicine. And internal medicine is really... what I always have loved about it is it's kind of like the problem-solving, Sherlock Holmes kind of type environment. So you're trying to figure out mysteries. And so you have to listen about what's wrong with you and what does it look like and what do the data show me. And then I have to kind of put all the pieces together to come to solve the mystery. So for example, things like, quite honestly, heart attacks, strokes, stomach ulcers, weird vessels in your leg, diabetes, high blood pressure, kidney problems, liver problems, all of that would kind of fall under the internal medicine umbrella.
Okay.
All right. So then but then because Lord knows that's not straightforward enough, we should make it even more clear. You have people who deal with folks in the outpatient setting, like you make an appointment, you go to see them in the clinic or something like that. And then you have people nowadays who just see people in the hospital who are sort of acutely ill. And as I did my residency training, what I discovered was I like the energy of trying to figure stuff out in a concentrated time frame. So I really struggled as I was finishing medical school. Did I want to do emergency medicine or did I want to do internal medicine? And I ended up picking internal medicine because I do like that kind of like sleuthing aspect. And I also like the ability to have a little bit more of a relationship with a patient and their families and stuff. Whereas emergency medicine is really chop, really quick. But I kind of found the best of both worlds by doing what we now know as hospitalist medicine. So that means you're sick enough to be in the hospital, you got to spend the night or maybe a couple of nights. And you're going to have a doctor who's going to be taking care of you. And those people are sort of additionally trained to deal with what we would call acutely ill. So the sicker of the sick patients, if that makes sense. So that's what I've spent sort of a 20 plus year career doing. And what I like about it is you gotta think quickly. You got to be able to make decisions based on often incomplete information. And so experience. And then also most importantly, your ability to connect with someone is really what matters, because people don't necessarily feel comfortable telling their doctors everything, or they've had a really bizarre experience and, they're kind of like jaded from that or scarred from that. And so the most important part of my job has always been, how can I make you feel as comfortable as possible in the moment, knowing that you're already having a pretty crappy day or you wouldn't be seeing me? And how do I make you feel sort of cared for and held and honored? And then that's when I get to the real nut of the problem.
That's beautiful.
So that's awesome.
That's bedside manner.
I wish every doctor felt like that.
Totally.
But I want to ask the opposite. So to foster that same relationship, what should the patient and the patient's family do, or how should they come into the situation?
So I think it's always tricky, right? Because if you're coming into an unplanned situation, your emotions are already
that's true.
Sky high,
that's true.
Right?
And that's different.
That is different, but it isn't necessarily, right?
But it's
because
true. People, when they don't feel good, you're not getting their best self.
Well, no one's getting their best selves. So I am lucky enough to help run a very large physician partnership that's all over the country. And one of the things that we really try hard to make sure that we're constantly teaching our doctors and our nurse practitioners and our advanced providers is, pretend it's you in the bed, or your mom or your sister, or your girlfriend, or, whomever it is. People are not patients. People are people. So if you put that in your head first and we're all going to interact like we're people, then I think that changes the dynamic. I think there's a lot of, I'll try not to swear, but there's pretty messed up power dynamics in the house of medicine that are kind of cultural holdovers, right? From the patriarchal, I am the doctor, the nurse will do what I say, the patient will do what I say, I am the person who knows everything. And I speak of the house of medicine as all doctors in general. Like, we have to really kind of push against that, because I know a lot about a lot of things, but I've never walked in your body. I don't know what you feel like today. So I need to interact with you or whomever it is as a person first. And then I can get all the data and the diagnoses and all that sciencey stuff, and I can put that around it. And that is something that you don't really learn in medical school. So when you really think about, like, who are those great doctors who you've just really loved, they're the people who are good at that.
Right. You're right.
So true. So true.
Because then you feel loved for and cared for. So it's not necessarily the guy who knows the most information. Nope. It's the person who can find out the information that is required, but really make you feel like there's nobody else that matters as much in this moment as I matter. And so that's a relationship, and that's like an even power dynamic. It's not the like,
yes,
you shall do this because I said so, So I think that's kind of actually the trouble. The challenge is there's a lot of older doctors who already started practicing. That wasn't a thing. There's a lot of younger doctors, and getting into medical school right now is no joke, right? You got to know a lot of stuff. And it's very detail-oriented, and it's super science-y, and it may be training some really good things, but maybe it's not training the things that we want the most,
Or evaluating.
Yeah, exactly.
Yeah.
And in residency, you would just be so tired. Like, the last thing you would think about is, how can I stop and sit down and center myself to
listen.
do this next thing. And listen to this next person.
They need to be in 5, Denise.
They do.
Yes,
they totally
they
do.
do.
It's so true, but it's really hard. And so, it ends up being, physicians have the highest, very high substance misuse problems. They have abnormally high suicide rates. This is National Suicide Prevention Month. Physician suicide is a real deal. All these people, your body has to cope with this stuff one way or the other, right? And so you either
find a coping mechanism.
Yeah, you either recognize it and you try to work through it, or you turn to something else that seems like it's going to at least make you feel better or numb for a certain period of time. So you're right. So people do have to be imbibed. And if you're going to be a successful anything, really, that's something that you've got to figure out. And so I think it's really cool that you do these things that kind of help people learn how to do that, because it's not something that, you go and figure out.
It's not what we've been trained to be evaluated
Correct.
on, to your point.
Totally.
Yeah.
Correct me if I'm wrong, but what I'm hearing is this group you work for is actually making an actual effort to change the culture, to teach the doctors what they're not learning in medical school, which I feel is 50% of being a doctor. Or what you're saying.
No, I mean, I think it's a massive amount. And there's so much information out there. Like, do I like Dr. Google? Maybe. Sometimes Dr. Google can be helpful.
You could be struggling with Dr. Google, because
sometimes Dr. Google is really not okay. Sometimes Dr. Google is not okay. And if you're already frustrated and you've already had a long night, and then somebody like slaps like 4 inches of paper that they printed out at home, and you're just kind of like, serenity now. So that's actually really hard. But you do have to teach people. So one of the things that I was really proud of, so my real love is palliative care. So I love hospice care. I love palliative care.
That's a calling.
It is a calling.
That's going to need to be another.
We can talk about that some other day. Yeah, for sure.
That's a tough one.
It's really hard, but it's also really freeing, because once people sort of acknowledge that they're near the end of their lives, like there is no more time for bullshit, and there's like true, honest, and authenticity. And if you can like help foster that, it can really, it sounds crazy to say, it can be a really great experience, but it actually can. So I felt like a lot of doctors aren't good at that. And what that means is, what they're not good at is having courageous conversation. And I think that's actually when you peel the onion all the way back to all of this stuff. How do you have an authentic conversation with another human being when you are delivering a message that nobody wants to hear?
Right. That's tough.
That's it.
That's tough for anybody.
For anybody, any
not
profession,
just a doctor.
anybody.
Anybody.
How do you tell your husband you want a divorce?
Right.
How do you tell, how do you have a courageous conversation, staying true to yourself, but also making sure that you're delivering the message that you feel like you need to say?
Yeah.
So
that's not being taught in any school.
Gosh, no.
No. It'd be nice if that started in elementary.
That would be good. That would be good. But it is not easy. It is not easy. And some people are better at it than others. And sometimes you have a little more emotional resilience and bandwidth to be able to do it than others times. It's not like, oh, I'm really great at this all the time.
Right.
And sometimes I feel like it's that whole like wisdom comes with age, right? I mean, like the things that you would have necessarily probably emotionally reacted to as a younger person. Certainly I did that as a physician. I wouldn't even faze me now. I'd be like, I understand where you're coming from. I hear you. Like, let's talk through this. Whereas I might have gone, before. So that's the tricky part.
So let's talk a little bit about people's struggles with the medical field.
Sure.
I know Amy has firsthand experience from your medical stuff that you went through. And I hear this all the time at the clinic, as far as people go through years of seeing different doctors before they get some sort of answers.
Well, I'd say that's important. And I think that's where finding doctors you have good relationships with is important. In my personal struggles that a lot of you have heard about, I have, a very rare condition in my lung, and something I had dealt with my whole life. I didn't know what it was. I just had things pop up. But then I reached a point where I kind of went off a cliff, and stuff just started rolling in hot, having intense dizzy spells, fainting spells, migraine headaches beyond. Like, I'd always had migraine headaches, but like to where I couldn't stand or walk without puking, kind of migraine head. I mean, just intense kinds of things happening. And just these really, really, really scary spells. The only way I can describe them is, I would say, is this what it feels like right before you have a heart attack or a stroke or an aneurysm? Which I now know probably, I probably have some insight into that. In fact, but here was the thing. Like, I knew something was wrong, and I kept going to doctors telling me, we can't find anything. You're having anxiety, or are you having anxiety? I'm like, well, not before I had the attack, but once I was on the floor with it, with 3 little boys in the house and alone, I didn't sleep the rest of the night. Yeah, for sure. And so it was just really hard. And it took me a long time to actually get the diagnosis and just the persistence of continuing to go until I found the right person who listened to me. And then he found it accidentally. Mm-hmm. You know, it's like looking for other things, and this came up. So, I mean, I guess that's one of my questions, or something I'd like to help people with, kind of knowing yourself, trusting yourself, and finding the person who will listen to you.
Yeah.
I have something interesting to add to this, because I recently just sat down with my mother and a good friend of hers, and this was a lighthearted, funny conversation, but it's not really a funny topic. But they talked about both of their mothers having medical issues and going to the doctors telling them they're crazy, and the extreme treatment that these women got. And now, granted, this is, 60, 70 years ago. But then it started making, my mom thought, well, maybe if she had that, and I'm going to be crazy too, right? You think that kind of stuff. And then they are like, well, it was menopause. They weren't crazy, right?
Well, menopause makes us all crazy. So, let's just put that out there.
But it was just interesting, you can feel like you're crazy when no one's kidding.
I went and saw a psychiatrist or a psychologist. I thought I might be crazy.
Right.
And, they do those intake tests when you first see a psychologist, and, and it was someone I had seen before in a different setting, so she kind of knew me. And when I filled out, she's like, so you are testing for being a bit of a hypochondriac right now? Because it was questions like, do you feel like you're sick and no one believes you? Yes, I do. I absolutely, every question was like that.
Right.
So even that was a journey.
Yeah.
Mm-hmm.
Well, and then it does actually kind of become a self-fulfilling prophecy, because you're like, I'm banging my head against the wall and no one is hearing me. So now my head actually does hurt.
Right.
Whether you believe it or not. So I think there's two things actually that are interesting in what you guys just talked about. I'm going to take the easy one first, and that's you, which is and again, we're still kind of left over from the patriarchy a little bit.
Yeah, it was definitely a symptom of that.
So hysteria, I'm crazy, hysteria. Hysterectomy, right? Way back when, in the sort of the Greek and the Latin and the very, very old ones, it all sort of came from the uterus. So that's all really, you could go down that little medical history rabbit hole. It's fascinating and effed up. Let's just say that. It's
I feel some more bleeps coming on here.
Definitely. I'm trying so hard not to swear.
There are so many stories.
Many. I mean, no, to the point of when women would receive electroconvulsive therapy, and really, really beyond.
That's what was happening.
Yes, totally. Mm-hmm. So there's that. Okay, but that actually is an important sort of backdrop for all this other stuff. So the people who are most often have the difficult diagnoses are the sort of 40 to 60-year-old women who present with an obscure problem. Mm-hmm. Now, sometimes it really is anxiety, and sometimes it really is depression. And so, there are plenty of times where that is true.
Which can cause the other symptoms,
Correct.
And I get that.
But that shouldn't ever be the first thought. That should be not necessarily the last thought. It should be one of many thoughts, but it shouldn't always be the first thought. So I think what I would say is to take yours to... what does a complicated diagnosis look like, and how do you work through that? Is one part of it. And then I think the other part of it is, again, getting to having an authentic relationship with another person is probably going to be tantamount to making any of the rest of this stuff kind of go away. So when something is not right. The human body is amazing.
Exactly.
Right? And when you're off. For whatever reason, and sometimes we can it's pretty obvious. Oh, I drank too much wine last night, or, I played tennis and I twisted my ankle. Sometimes you're cause and effect makes sense, but sometimes you have no idea. And the ostrich fantasy is always it's the human nature. It's the first thing you go to. You're just well, maybe if I just pull my covers up, it'll go away tomorrow. Right. Well, and sometimes it does. And that's great because, we are very resilient organisms and we really can come through a lot. But sometimes it doesn't. And so then you have to you go on a hunt. And this is when I said, this is why I picked internal medicine. Because I love that stuff. I love to sit and try to figure it out. Here's a problem. In the way that medicine is practiced today with your HMOs and your PPOs and your whatever, I got 8.5 minutes to figure you out. How is that possible? That was a big part of why I really didn't feel like I would be happy being in a clinic talking to people, because I never felt like that was ever going to be enough time for me to really get into it. Whereas in the hospital, even though it seems more intense, there is actually more time, because you're not on these like 15-minute, increments, and I can really kind of I can sink into what it is. And this is what's called being a great diagnostician. And some people are and some people aren't, but it is all about listening and like really hearing someone, not just going like, oh, 40, mid 40s female, 3 kids at home, husband's out of town a lot, having weird headaches, and you're like, you're not listening to me. You're just running down the like ticker box of symptoms. And yeah, those are all important to register, but like you also have to be able to put them together. Mm-hmm. So I guess I would say if you are struggling with trying to find a diagnosis, it's worth it to do a little bit of doctor shopping until you feel like you find someone who is actually hearing what you have to say.
And I did.
Yeah.
And I did. And that helped. Although I'd only been in Austin for about a year-ish at that time. So that's the next question. How do you do that? How do you find that doctor, especially if it's not an area you've ever needed to delve into before, or people move all the time right now? How do you go about it?
Well, I think that's actually really hard, because then you have to also layer, and are they covered on my insurance? Right. So that's always an added pain in the neck factor. I do feel like word of mouth is never the bad idea, because let's be honest, people know if they've had good experiences. As a general rule, I'm not a huge fan of either the Google or Yelp for medical reviews. I just
agreed.
And it's so skewed.
Skewed.
It's just not really worth it. So I would say church groups or mothers clubs, or your country club or your pool, or all of those sorts of things. I actually think is probably the best way. I wish there was more of like an Angie's List kind of type vibe for medical stuff, but there isn't. And so it's usually just people who go on tirades, and unfortunately they're dissatisfied with some element of something. The back office lady was rude, or I didn't get my bill. It has nothing to do with the doctor. So, and I mean, maybe it had everything to do with them. It's hard to say, but I just don't feel like that's necessarily a really great source of meaningful information. The other thing that you can always do is you can always go to the medical board websites of any state. So in order to practice medicine in a state, you have to hold a license to practice in that state. And they have a list of all of the doctors and what are they board certified in and what do they do. And so that's a really good kind of place to start.
And if there's ever been a complaint.
Correct.
All of that.
Correct. It's all there on the website.
Which is more than just griping.
Which is more than just griping. Yes. It's a for real complaint.
If they make the complaint and the board decides it's not,
then it's
not up there.
That's right.
It's only if the board has reprimanded them.
That's right.
You see that.
That's right. And so those are usually fairly egregious. So if I looked at someone and they had something like that, that would not be the number that I would call. I'm just for me personally. But anyway, so I think that is at least like a source of truth, and it's not just people kind of complaining about it. So, but then I think you just have to you have to feel comfortable.
Find the person you click with.
And that may take some time. And I will say that 90% of most diagnoses are very easily made, period. Fortunately, things usually happen in fairly, routine patterns. So
that is surprising to me.
Yeah.
90%.
Yeah. I maybe it's somewhere between 80 and 90. But
still. That's a lot.
But usually they're pretty straightforward, they're pretty obvious, and the rapidity with which the correct diagnosis is made is like, okay, that's great. But like in all things, in all things, the 80-20 rule still applies, right? And that sort of more mysterious tranche is really mysterious. And it might take a lot of time. The good news is the stuff that kills you, pretty obvious pretty quick. The stuff that's like, ugh, what is this? I don't feel good. Like maybe harder to find out. Those are the things that end up in that mystery section. So that's one maybe little nugget or, kernel of okay, well, if there was something like really wrong with me and I was going to keel over 3 weeks from now, that would be pretty straightforward and easy to find.
Yeah.
If we're going on a hunt, then that's probably, I have a little more time to do it. That doesn't mean you don't want to still do it, but at least you can feel a little bit more comforted. The other great way to choose a doctor is if you have a doctor, ask that doctor who their doctor is.
Yeah.
Oh, that's really good.
Because there's actually no higher compliment you could pay to another doctor than to be like, you're a doctor's doctor.
Yeah.
That's a big deal. Because what does that mean? It means you're smart, you listen, you put it together in a way that,
somebody in your own profession respects you for it.
Correct.
Yeah.
So the doctor's doctor is really kind of what you're looking for. Obviously, maybe there's not that many of them out there. I don't know. But those would be my sort of like very broad brushstrokes of how I would go about doing it.
I love that.
Yeah.
And then there are places where they really pride themselves on nothing but mystery diagnoses, right? So the Mayo Clinic, MD Anderson for cancer stuff. That doesn't mean everyone has to like run off and go to the Mayo or Hopkins or whatever. But, those are places where they pulled in all of these kinds of experts.
And I will say, in my case, that's where Dr. Google helped me because once I had a name, I was able to Google and find a treatment center of excellence and get myself there and say, and I did ask the doctor who diagnosed me in Austin, if it were your mother or sister, would you let them be treated here? And he said, no, I would not. I would go to Dallas or Houston. And I said, okay, I better do some research then. And
Right. And so that's where, you kind of need to be involved in what it is that you're doing. Like no one should be a passive recipient of anything, I don't think. But you also want to ask for, you're asking for expertise and advice. So it's a balance of both.
But you have to advocate for yourself.
Totally.
And I do think it's both. And it goes back to that patriarchal thing. I know I saw in some people in my life, like my parents, for example, who have both passed away but went through major illnesses, where they almost just seceded their autonomy over to the doctor in that same sort of, he is so educated and smart.
It's that God complex that that generation
completely
had.
And so there is a balance between respecting what the doctors are saying and also figuring out what works for you and
because it's got to work for you. If it doesn't work for you, it's not going to work. So I'll say that. I don't think it's necessary. Like in a therapeutic relationship, you don't need to be like arguing with and I think like because I've seen some
then I feel like you're getting nowhere.
Well, people are very confrontational, like, oh, you're not advocating for my mom, and you're like, time out, man. Like I understand that she's your one mom, but I am currently taking care of 100 moms. So what do you want? Do you want your N of 1 as a sample size, or do you want my N of 40,000 people that I've taken care of? So that is a little bit. And so when you're having one of those days where you don't have a lot left in that emotional resilience tank, it's really hard not to get snarky back with them, know? So it goes both ways. And so I think there has to be kind of a mutual respect of what it is that we're trying to do. Because at the end of the day, maybe there are some very weird, rare exceptions. Like we all got into medicine to make people feel better, period. Right. That's what we did. None of us put up with the 12 plus years of school that it took afterwards to like be like, oh, I'm just going to make money and I hate people. Like, like you really had to really want to keep doing it.
Yeah.
So, and honestly, I mean, I think we're all at a place where we can say there are easier ways to make money.
Oh, a lot more money. Easier and a lot more. There's no doubt. So it's funny. So I was at Stanford in, I graduated medical school in 1997. So it was like right as that whole first, like the internet, www. And all of these people were like, oh, I'm out. I'm going to, and half of my sort of entering class for Stanford for residency, when Google didn't even exist, it was like Yahoo and Netscape and, all of this kind of stuff. Yeah. And they made a ton of money.
Without 12 years of school.
Without like the extra, all that stuff. Yeah. It's really interesting because a lot of them have now come back to medicine because
it's a calling.
You get to make people feel better, which
meaningful.
And it's there's a lot of immediate gratification which you don't really get in a lot of careers, like where people literally are stopping you and hugging you and saying thank you so much. What would I have done without you? And I say I don't know what I would have done without you. So. It really can be just the best. It can be the best and the worst job in the world.
Yeah, because it takes a special calling to know that maybe something you do, the other person could die. You know, I'm not saying that.
The stakes are high.
The stakes are high. It's like, I know with my husband being a physical therapist, chances are no one's dying on his table.
Right.
You know, if he makes a mistake, that's not usually the outcome in an outpatient physical therapy clinic, right? So not taking that risk that you're taking kind of thing.
Yeah.
So
nope, the stakes are high.
Yeah.
That being said, you know, you have the opportunity to make people feel better all the time, and you never even know what part of the interaction is really going to be the part. So, like, I've got my big meeting with all of our physicians coming up next week, and I get a chance to talk to them, and there'll be several thousand people on the webinar. And the moral of the story is, with each and every person that you have the chance to take care of and lay hands on, and you have the opportunity to make them feel better. I may not be able to fix you. And I think that's important to recognize. I may not be able to fix it. I may not be able to cure it, but I absolutely can make you feel better from interacting with me.
Mm-hmm. That's beautiful.
Period.
We'll get into energetics next time too.
I know. But I think the beauty of this is you really exude an imbibe idea when you're trying to deal with patients.
Yeah, I guess so.
And you're trying to make a bigger change with not just you individual as a doctor, but a whole
bunch of doctors.
Yep. I mean, I think healthcare really needs to move this way in order to deal with the patients that are evolving this way.
Imbibe medicine.
It actually is a great, I mean, so we did this thing with palliative care and courageous conversations. And so we actually had all of our docs go through this thing where we hired medical actors. So they're like they're actors, but they have this special training where they kind of know the words and whatever, and they act like either patients or their family members or whatever. Mm-hmm. I gave a whole talk on how to have a courageous conversation and what that meant and how to be authentic. And then we made them practice in these like groups. So they had, and they had to like present, and then people got to critique them, the actors and the other physicians. And then I made a couple of them actually go and do it in front of our whole partnership, like in front of several thousand people. And it was really intense, but everyone was like, oh my God, this is great. And it's one of those things where you practice and you drill and you train for all of these things that are really important, but the stuff that you don't realize is probably maybe not as impactful, but pretty darn close. You just sort of hope that people kind of pick that up along the way. And so that's the part where I feel like we have to we owe it to everyone, to kind of be like,
the doctor and the patient.
Yeah, let me show you how to do this a little bit differently. Yeah. Yeah. That's cool.
Did we even cover Denise's background? Like
we did. We talked about you being an internist.
Yeah.
Did we say like Stanford?
Oh yeah. I mean, I've got a nice pedigree. It's all good. But
it's all there, just so you know. And so I feel like this was a good introduction. We weren't quite sure where this would go.
No, you never know, right? I mean that's the best conversations.
Didn't anticipate to a disco, and so. But when you started a disco, you can only go up, right?
Well, some would argue you should just stay right there at the disco. That's my take, anyway.
Well, this has been awesome. Thank you so much.
Yeah, we'll do it next time.
Yes. So everybody submit your questions
or topics that you'd like to get Denise's intake on. We'd love to hear what you're thinking, maybe the things you don't know enough about or wish you knew more about, or something we haven't even thought about.
Yeah, and share this with friends. If you have friends that might want to talk to Denise, share it with them, and so we can start interacting with them and get those questions in. So thanks for watching, and thank you for coming.
Thank you,
anytime.
Denise.
All right.
And thank you, Chewy.
Yeah. Oh, yeah. Chewy's I use my little love bug. I love that guy. Have a great day.
Bye.
Thank you for listening to Imbibe Life Conversations. For more information and to join our community, be sure to check out our website at imbibelife.com. We look forward to sharing with you.